There is no specific treatment for the dengue virus as such. So when your child has high grade fever during this period between July to October, and then you approach a doctor, your pediatrician, then he will see, and if, as I said, if there is a doubt about dengue, they are going to advise you certain tests. So a common test will be a complete blood picture where they would like to know what is the platelet count and what is the hemoglobin and WBC count, and also they would do a dengue test. In a dengue test, in first 24 hours usually we don't do dengue serology test. After day 2 or day 3, NS1 ELISA test is the most commonly done test, and from day 4, day 5 onwards, dengue IgM, IgG, pan bio ELISA test is done most commonly and most reliably. These are the tests which are endorsed by the WHO also. There are card tests also available which are cheaper, but they are not reliable and they are not endorsed by the WHO. So when your doctor or your pediatrician will diagnose dengue, then as I said, most of the times your child is not going to be very sick. So it's only going to be high grade fever, some rash, but the child will be stable if the child is alert, active, and otherwise accepting oral feeds and drinking, eating. Then the doctor may advise you to just take rest at home and keep doing the complete blood picture, this blood test, just to know the platelet counts, maybe on everyday basis or alternate day basis, just to see how the platelets are falling. So in most of the times in dengue, the platelets will fall, and then from day 7 you will see the platelets rising on their own. Some people try to give papaya leaf abstract or kiwi food or something, hoping that platelets will increase because of that, but there is no scientific proof for those things. So better to avoid such things. Just eat, you give your child normal food and less oily, less spicy, simple food, plenty of water, give rest, control fever with paracetamol, and follow your doctor's advice of doing the blood test and follow up with your doctor. In more severe patients where there is very high grade fever, your child is drowsy, dehydrated, not accepting oral feeds properly, your platelets are falling very rapidly, in those patients the doctor may advise you to get admitted in a hospital, and then they will start treatment with IV fluids. And God forbid, if your child is very serious, like blood pressures are really going down, or there is involvement of liver, or there is involvement of brain and the child is having seizures, or there are clotting problems, child is bleeding badly from the intestine, then in those patients your child may require admission in the ICU. So you then need to admit your child in a good ICU, in a good pediatric ICU which is well equipped with experienced doctors, experienced nurses, good equipment to monitor your child properly and take care of your child in a more expert manner.